What global efforts ensure consistent bone density testing? Imagine trying to compare bone health across different countries and clinics. Without a common standard, it would be like comparing apples to oranges. That's why international efforts focus on creating uniform guidelines and quality measures for bone density testing. The main goal is to make sure that when someone gets tested for osteoporosis, the results are accurate, reliable, and comparable worldwide. One key effort is the adoption of standardized diagnostic criteria. The World Health Organization has set clear rules for diagnosing osteoporosis based on bone mineral density measurements taken by dual energy X-ray absorptiometry, or DEXA. They use T-scores, which compare a person's bone density to that of a healthy young adult. A T-score of -2.5 or lower means osteoporosis. If the score is between -1.0 and -2.5, it indicates low bone mass or osteopenia. These standards help doctors around the world interpret results consistently, making sure patients get the right diagnosis regardless of where they are. Professional organizations also play a vital role. Groups like the International Osteoporosis Foundation, the National Osteoporosis Foundation, the American Association of Clinical Endocrinologists, and the International Society for Clinical Densitometry promote these standards. They provide training and certification programs for healthcare providers who perform and interpret DEXA scans. This ensures that technicians and doctors follow best practices, reducing errors and variability in testing. Quality control is another crucial part of global efforts. Countries and clinics implement regular calibration of DEXA machines and follow strict scanning protocols. Certification programs ensure that operators are skilled and consistent. These measures help maintain high standards and reliable results across different settings. To improve risk assessment, many guidelines recommend combining bone density results with other factors like age, gender, and medical history. Tools like the Fracture Risk Assessment Tool, or FRAX, estimate the chance of fractures over 10 years. Using these tools alongside BMD results helps doctors make better decisions about treatment and prevention, creating a more comprehensive picture of bone health. International guidelines also specify who should be screened and how often. For example, women over 65 and men over 70 are often recommended for testing, along with those who have risk factors like fractures or certain medical conditions. These recommendations help ensure early detection and consistent monitoring, no matter where a person lives. Finally, global research collaborations and data sharing improve testing standards. By studying diverse populations and sharing information, scientists refine diagnostic thresholds and improve technologies. This ongoing cooperation helps ensure that bone density testing remains accurate and relevant for people of different ages, ethnicities, and backgrounds. In summary, worldwide efforts to standardize bone density testing include adopting clear diagnostic criteria, promoting professional training, maintaining quality control, integrating risk assessment tools, and following evidence-based screening guidelines. These coordinated actions help ensure that everyone receives accurate, consistent, and meaningful assessments of their bone health. Always remember, if you have concerns about osteoporosis or bone health, consulting a healthcare professional is the best step to get personalized advice and care.